I'm Chris Matthews, I'm Chief Exec of Alevere, and we are a specialist weight management company. Alevere is a specialist medical weight loss treatment that's carried out under the supervision of qualified medical doctors, many of whom are family GPs, general practitioners. Our typical patient would have a minimum of 10 kilograms of fat to lose, and we would treat that patient over a period of averagely about 12 weeks. Our introduction to InBody actually came as a result of having tried several other body composition tools, mainly electrode based, but the placement's very challenging, and so you don't end up with the consistency of result. So you can measure the same patient on the same day within an hour of the measurements, but you would get completely different results dependent on electrode placement on the foot or on the wrist or on the ankle. So we wanted to try and get much more consistency. So segmental analysis is very important for us, because different people definitely store fats in different places, and without the InBody it's almost impossible to identify perhaps the percentages or where the fat is. Certainly visceral fat is the fat that we see very, very quickly removed when patients are following the program. Being able to show a patient that they're making this huge impact on their health, particularly on the visceral fat levels, which we see dropping very, very rapidly over the first few weeks of treatment. It makes a huge difference to the motivation of that patient. So we use InBody extensively through a patient's journey with us, but then when they finish the program, we constantly monitor their body composition to ensure that if they are putting weight back on, that it's not body fat that they're storing, so we can take remedial action and help them get back on track very, very quickly. Our experience of dealing with InBody UK as a company has been outstanding. The level of training, their care and attention to detail in terms of getting our staff up to speed, and the great thing is they can talk to the team at any level. So we have medical doctors who've had training at perhaps a slightly more medical technical level than is necessary for maybe an operator or one of our clinical therapists, who needs to explain the basics of the results to a patient, but not necessarily go into the medical diagnosis side of the results that a doctor would be able to go into. So we feel that InBody have been able to train us at the different levels of skill, of knowledge within the business, and we find them extremely easy to deal with.